The two Tory leadership candidates, Jeremy Hunt and Boris Johnson, have been challenged to urgently bring forward plans to tackle the social care crisis if they become Prime Minister. A committee of peers has called for an immediate £8 billion cash injection and a move to a free NHS-based system. Let's get some more reaction on this now. Joining us from Salford is David Rowland, the Director of Centre for Health and the Public Interest. Thank you very much for joining us. How much of improving social care in this country is about throwing more money at it?
Well, that's a very good question. I mean, the figures that are being talked about at the moment are significant. 8 billion a year additional is a significant sum of money, and then increasing that money to 15 billion a year by the mid-2020s is again a significant injection of cash. And in many ways, that's very much to be welcome. You know, the committee has come round to a set of conclusions that the Royal Commission on Long-Term Care actually arrived at 20 years ago, back in 1999, and that was that we need to make personal care for people when they need that towards the end of their life, free at the point of delivery, funded out of central taxation. However, there's a really interesting issue here about whether that 8 billion right now and the 15 billion in the future is actually going to be enough. And the reason I say that is, okay, it's great that the availability of care is going to be expanded, but what actually about the quality of care that's going to be provided? Because we know right now that the care system is not delivering great quality. We know, for example, that 1 in 5 care homes are either rated inadequate or poor. We know that 1/3 of care workers are operating on 0 hours contracts. We know that there's very high turnover within the care sector. So I'm a bit concerned that the figures that have been talked about thus far, even though this move by the committee is to be very welcomed, might not actually have costed the full increase necessary in order to deliver the quality of care that is required.
Because inevitably, if you want to increase the professionalism within the sector, if you want to increase the quality, will it necessarily cost more?
Well, I think if you're looking at turnover within the care sector of 30%, when that equates to about 390,000 care workers leaving each year. And that suggests that the reason why the care workers are leaving is because the rates of pay are not good enough, the terms and conditions are not good enough. If you've got a turnover rate of 30%, it's going to be very difficult to be able to deliver a high quality service. And let's also not forget that despite the very hard work that lots of those care workers do, many of them operate without having any qualification at all. They have very little training available to them, and much more money needs to be pumped into that area in order to justify the taxpayer spending much more on social care, and indeed for the public to be comfortable that any taxes that they're going to be paying are actually going to deliver better quality outcomes.
Where does the money that's spent on social care actually go if it's not all going to the front line?
Well, this is something we started to look at quite recently at the Centre for Health and the Public Interest. We're concerned that there is a lot of money that goes into social care at the moment, particularly into the residential care sector, which actually doesn't go to the front line. It leaks out into various different areas. And I'll give you an example. In the 26 companies that operate 1/3 of all of the care homes in this country, £200 million a year leaks out of that sector in the form of management fees for private investors. That's 200 million which doesn't go anywhere near a care worker, which doesn't go anywhere near a person who is using services. If you add in the rental cost to landlords, if you add in the debt repayments, and if you add in the profits that all equate within that particular part of the sector, you're talking about £750 million a year. Now, to put that in the context of today's announcement, that's around 10% of the amount that the committee is recommending should be injected into social care right now. And again, I think that's another important point for the public to be aware of. If they are going to be asked to pay more tax in order to have free care, if they're going to have to pay more tax in order to have higher quality care, they want to know that they're getting value for money. They want to know that as much of the money that is going into social care is actually going to the front line. So another issue that needs to be addressed is the financial structure of the care home industry, that there needs to be greater understanding of where money within the system currently goes.
How do you stop that money heading in the direction that you've just described without fully nationalising all social care in the country?
Well, you know, there are various options which policymakers can adopt. I don't necessarily think the full nationalisation option, you know, it is the only option. There are different parts of the way in which the public sector contracts, for example, with the pharmaceutical industry or the defence industry, which says we're going to cap your profits. We're going to cap your profits at 5%. That doesn't happen within the residential care sector at the moment. You could also have a situation where those residential care providers are required to be tax registered in the UK, because lots of them aren't. You could ensure that those who are providing care services to a local authority, who are providing services directly to the taxpayer, dedicate a certain proportion of their income on staff wages. That would give a good indication that they're committed to delivering a high quality of care and that there aren't significant amounts of money which are leaking out of the system. So there are other ways of doing it without having to go through the nationalisation option.
David Rowland from the Centre for Health and the Public Interest, thank you very much for talking to us this afternoon.
Thank you.